Is breast milk enough to provide the right amount of vitamin D for my baby?
That's a really good question that you ask. I'm really glad that you have decided to breastfeed after you deliver your baby. But what we know about breast milk is that breast milk vitamin D content is really dependent on how much vitamin D you have in your body. So we don't want excessive amounts of vitamin D because that can be toxic. But we don't want your levels to be so low that what's in your breast milk is low, and then your baby would be vitamin D deficient. So there are two ways of having enough vitamin D for your baby. If you're vitamin D deficient, then your breast milk is going to be low in vitamin D, and your baby will then be vitamin D deficient. The American Academy of Pediatrics and other organizations recommend that if you're breastfeeding, you would give your baby within a couple of days of birth 400 international units of vitamin D. So it could be what would be in an infant multivitamin or just directly of an infant vitamin D preparation. That would ensure that your baby would be getting enough vitamin D, but it doesn't ensure that you yourself would be getting enough vitamin D. And we know that if moms are taking more vitamin D as a supplement, then their milk has a higher amount of vitamin D, and that is then transferred to your baby. We've done studies here at the Medical University of South Carolina, and there have been other studies that have been done around the world looking at giving mothers higher doses of vitamin D. And we recommend 6,400 to 6,600 international units a day for a breastfeeding mother to get her levels to be what would be equivalent to what is in 1 teaspoon of cod liver oil, which was found to be the amount to prevent rickets. So if mom's milk is rich enough in vitamin D, then her baby does not need to be supplemented. However, if you don't want to do that, then you certainly need to supplement your baby with a vitamin D supplement every day. And the other issue that we have to say is that if you are not able to give your baby a supplement, or if you stop breastfeeding, then and if your baby is formula fed, and your baby's taking in less than about a quart of formula a day, then your baby also needs to be supplemented with a vitamin D supplement. And once your baby's taking more than a quart of milk or 1 liter of formula a day, then your baby would not need to be supplemented. But those are important points.